very much for having me. I think as Nigerians, we've started doing something, but I can say we have a long way to go in reducing stigma, barriers to access to healthcare. And like my DG said, I think it's very important to improve for us to get getting children not getting infected from HIV. We need to start from making sure that the women attend the ANC. And like in Kano here, we already started what we call engaging the men, role of men. We're trying to make the men understand the need for their wives to go to the hospitals so that they'll be checked and do the other thing. And then another thing too that we have done as a government in Kano, the premarital screening law has been passed, which means that for you to get married, you must be tested for HIV, hepatitis, and sickle cell disease, because that's the entry point. And then testing you it doesn't mean that you might not get married, because there's what we call PrEP. There are other methods you can use whereby even if the person, one of the what we call the discordant couples, if one of the couple is infected, can still go ahead and get married, and we've already put that in process, and also the anti-stigma law. And we also have what we call mentor mothers, who are members of the NEF1 who go into the community to reach the unreached, whereby some in some communities, either due to lack of access to services, or the services are not reached, or the people, like you said, the poverty, people cannot afford to go to those people. So these mentor mothers, who are also part of the community, who are taken from the community, go around and see that they link up these pregnant women to the service providers so that they will be tested for HIV and tested. Another thing is the commodity supply, because in some places you don't have commodity supply, but alhamdulillah in Kano State we have been getting our consumables like the test kit, which we're using now, even the combo. We're using the one that has HIV and syphilis and the hepatitis B, so that at least all pregnant women will be screened for these three diseases. And also collaboration with TB, HIV. We're also, like we have here in Kano, HIV is under one roof, meaning that all HIV, the health sector and non-health sector, because as we know, HIV is not only a health-related disease. You need to look at other social factors that in the society, like the education. You need to improve the education, like you said, the awareness. And also, even the prevalence in Kano, even though you said the prevalence is low, Kano is the most populous state in Nigeria. So if you look at the prevalence of 0.6% and put the numbers, 20 million inhabitants, and take another state that has a prevalence of 4 or 3%, and maybe they're at only 2 million, you will see the absolute number is more in Kano than in those numbers. And then also, we have a lot of immigration, people coming into Kano because of the safety and the culture that are happening. So people are coming from non-secure zone, places that have insecurity issues, so they are coming in with their culture and values, which might be different from the one here. So, and then also poverty, like you said, there's a lot of activities that are carried out that will affect the control that we're having in the states.